My name is Mrs. Natasha Graves Covington. I'm going to give you a little bit of background about myself. I'm in my last semester at Winston-Salem State University. Woohoo! And I currently have an associate's degree from Alamance Community College in medical laboratory tech. And I am ASCP certified. I've been working for the last 5 years as a generalist at a high complexity lab at the hospital. I would like to also give a little bit of acknowledgement and my gratitude to a few people. First and foremost, my mentor, Taya Good, for guiding me and helping me along the way. And to Mrs. Tyfenbeck, my instructor, for helping and guiding me also and giving me the courage and the skills that I need to be able to present to you a new testing method to diagnose Lyme disease in the early stages. Um, as we all know, Lyme disease, while clinically understood, represents an enigma in the United States. The geographic distribution of this disease is not well understood, nor is it actually prevalent of the infection. Because of this, it will be most beneficial for clinical laboratory scientists, as myself, to have access to a fast, sensitive, and specific method for an assay of this organism. And so doing, laboratory clinicians will be in the position to provide more and better information to physicians to coordinate care for their patient if we're able to diagnose Lyme disease at an early stage. And right now, we're not able to do that. We'll take it, for instance, as the guy I have here, the bullseye pattern where he was bit by a tick. And he has the signs is there, but the method is not there. The method to use with the beginning stages of Lyme disease is not there. One of the most common tick-borne diseases in the United States is Lyme disease, as I first mentioned. Lyme disease, of course, you know, is spread by the tick. In most cases, are due to the black-legged tick. Right now, the sensitivity of antibodies-based tests increase with the duration of the infection. And patients who present very early in their illness are most likely to have a negative result, which is our problem. Within days or even weeks that the patient is bit by the tick, a patient can develop skin lesions, migraines, and pain, arthritis from the tick bite. The patient can also develop neurologic problems, cardiac problems. The lack of sensitivity, relatively easy, fast, direct tests for Lyme disease is the main challenge in the laboratory today, which, as I stated, is definitely a problem. Right now, I gave you a graph here, and I'm not sure, can everyone see it? Okay, thank you. Right here is the two-tiered testing for Lyme disease, which is being performed by the CDC, the Center for Diseases and Control. The IgM antibodies will not be detected until after 2 or 4 weeks of the signs and symptoms of the antibodies, for the IgG is not detected until 4 or 6 weeks of the signs and symptoms. Therefore, in some patients with early diseases, diagnosed must be made by the clinical findings. It has been times that the laboratory will interpret these results incorrectly, which means it's a false negative. And of course, as we all know, that is definitely a problem. A patient that is negative is usually have one band reactive from the past infection from a different organism, not even from what they have now. What's going on with them now? Also, a positive serum will react with 5 or 10 score bands, and again, that is shown here. IgG assay and 2 or 3 bands on the IgM. The laboratory is still very challenging culturing for Lyme disease. The organism is presented, and the reason antibody testing is right now is preferred. The Center for Disease Control and Prevention do not recommend assay for antigens in urine culture, immunofluorescence staining, or even cell sorting of a cell wall. There are still advantages and disadvantages with screening the general population. And that comes to why it's important to screen early on for Lyme disease. It is important to screen early on in Lyme disease, and let me talk to you about my method of what I'm trying to propose here today. The study that I would like to do, we will be using 200 people consecutive presenting patients with negative and positive results, and the method that I would like to use is a lymphocyte transformation test memory immunostimulation assay. It's pretty much a kit test that shows at the very beginning that a person is positive for Lyme disease. The study will be approved by your board here at North Carolina A&T State University Committee. The study is separated into groups. And the group 1 of the analysis showed that the sample was actually positive. We'll show that the samples are actually positive following the criteria that will be met. Samples will be proven positive for Lyme disease on one or more of the following: clinical rash, positive serology, and culture sample. In my study, I'll be using an ELISA/Western blot testing method, where only from my research, some of the research that I've done, 57% was accurate. The same blood serum sample will be used using the lymphocyte transformation testing, where it should be, if you have it, 93% of the people at the very beginning of having Lyme disease will be positive. We'll show that it's positive. And it is a kit test. It's cost efficient, it's easy to use. Anyone in the lab can do it once you're trained to be able to diagnose Lyme disease on the beginning stages. With using this new method, which is the lymphocyte transformation test to diagnose Lyme disease, will decrease the number of false positives and ensure that the patient is being diagnosed and treating accordingly. And that's what's important here, that we're able to treat and diagnose the patient with Lyme disease accordingly and fast. The lymphocyte transformation test will also be defined the disease sensitivity of each stage of the disease, not just the beginning stage of Lyme disease, but also the ending stage of Lyme disease. The sensitivity, specificity data, disease stage, and the test methods were all included in this so we can do this study. The study, like I said before, the study will test the sensitivity for the disease stage and the acute early detection, and it should be 46.5% for sensitivity, neurologically 87.3%. Arthritis, which Lyme disease, if goes untreated, causes arthritis. For testing for this disease. Other testing which is a lot better than the other testing methods that is used. In the early stages of Lyme disease, the lack of early detection is still well recognized. However, using this test method is still more accurate than any other testing method at this time. The test is easy to perform, and it is a kit test that still relies on antibody detection, but more sensitivity than what is currently being used. In conclusion, the general clinical practice is not uncommon for a physician to have patients present for the non-specific symptoms such as fever and chills, general fatigue, persistent headache, and general achy feelings of muscles and joint, and perhaps even swollen lymph nodes. In addition, a rash may occur which starts the location of the initial bite by the tick. It may be exposed to cover a larger area of the skin, becoming warm to the touch. These rashes are not usually itchy or painful and may be misdiagnosed by other skin conditions. Since the symptoms may relate to any number of diagnoses, it is very important that a clinical laboratory professional to have their call a test is relatively uncomplicated, straightforward to interpret, fast, sensitive, and specific for the condition being tested, and cost effective. This allows the treating physician to order the proper testing without placing an undue financial burden on the patient. Because of the severity of later symptoms of Lyme disease, such as severe headaches, more and larger rashes, different parts of the body, severe pain in the joints, and the onset of arthritis, the possibility of partial and complete facial palsy, and irregular heartbeat, clinical laboratory scientists should be at the forefront of the research and implementation of new testing methodology and to aid in fast and accurate diagnosis, which results in an optimal clinical outcome for the patient. The new testings will also be a better relationship with the doctor and the lab tech, as myself. Again, like I said, it is a kit test. It is easy to use. It's low on cost. But while we're here, we need the funding. We need the funding in order to put this together and try to diagnose Lyme disease at an early stage. Again, my name is Natasha Graves Covington. Thanks a bunch for even listening to me and looking at my board, and let me present this to you. You guys have a great day. Any questions? I'm sorry, any questions?
No.
No, yes, sir. It is oh, no, okay, thank you. But yes, sir, to your question, it is a kit test. It is a kit test that will be used to diagnose Lyme disease at the early stages, that's something we do not have yet. Again, thanks, and you guys have a great evening.